Welcome. Welcome to the video on effect of pranayama on variables. And these variables are of two types. One is a physical variables, and the second one is a psychological variables. So in this video, we are going to talk about basically trying to understand the impact of pranayama on these variables. Now, the first study, what we are going to look into is the effect of pranayama on changes in heart rate. Now, this uh, pranayama has been quoted as one of the means by which you can reduce the heart rate. A study by Jane and Ital, and it was a randomized clinical trial. Randomized clinical trial means the subjects are not aware about who is given the treatment and who is not given the treatment. Now, they used an integrated tele-yoga intervention. Yeah, tele-yoga intervention means they use the yogas which was televised, and these two basic pranayamas, Nadi Shodhana and Bastrika, and it was done for 6 minutes. And the study focused on impact of intervention of both physiological and psychological variable. And what did they find? They found that 8.2% reduction in heart rate for the experimental group compared to the control group. That means they had two groups. One is a experimental group, another one is a control group, and the impact of these two pranayamas, that is the Bastrika and Nadishodhana, it reduced the heart rate by 8.21%. So that means this is a and this between the control group and the experimental group, this difference was observed. And then in the second study, which talked about Rohini et al., this study basically looked at Shitali pranayama, which is a cooling pranayama. And what did it do? It also decreased the heart rate compared to the normal breathing, and it was found to be statistically significant. Now, the concept of statistical significance is when the decrease can be measured, and this decrease is not due to chance causes but due to assignable causes. This decrease have been noted. So we could say that there is a significant decrease in HR, or the heart rate, compared to the normal breathing. Another study by Pramanik, which reported that this slow paced Bastrika pranayam had a slight reduction in the heart rate. So we would see here basically the pranayamas, Nadi Shodhana, then comes Bastrika. If you see both these studies, Bastrika is reported for a decrease in heart rate, and in both the studies there is a significant reduction in the heart rate. And the third study, which looked at a cooling pranayama, Shitali, this led to a statistically significant decrease in the heart rate. So we see here three things. These three pranayamas has had an impact on the heart rate variable, heart rate. Now we talk about the changes. First, we talked about the heart rate, and what about the variability of heart rate? Now, how did pranayama have an impact on that? Now, if you look at the study by Sharp et al., who carried out a clinical trial to investigate how pranayama impact the HRV, and they reported that concepts like sitting quietly, self-paced deep breathing, externally paced deep breathing, and self-paced Shitali and Shitakari pranayam, which is also a cooling pranayam, and externally paced Shitali and Shitkari pranayam. So self-paced, depending upon the pace of the self, and external means somebody is forcing you to do to increase or decrease. Now, all these five practices increased the heart rate variability. Externally paced breathing at 6 breaths per minute result in more significant decrease in HRV than the slow paced breathing. Now, here we try to understand there are five different manner in which the interventions were carried out. The first one was sitting quietly. The second one talked about a self paced breathing. The third one talked about here externally paced and deep breathing. And the fourth one was on self paced Shitali. Both are cooling and Shitakari. And the fifth one was externally paced, both Shitali and Shitkari. Now, what did it find? Now, this is almost like 6 breath per minute. That means you would say here 60 divided by 6, almost 10 seconds per breath. Now, this was compared to all other four forms. Externally paced Shitakari and Shitali resulted in decrease in the heart rate variability. And there was one more study by Tankalakshmi et al., who also carried out this is not a randomized control trial, whereas this is a randomized control trial to investigate now specifically the study of which investigated the impact of only Shitali pranayama. And what did it look at? It looked at the cardiac autonomic function among patients with primary hypertension. And they reported that Shitkali pranayama had a significantly reduced short term heart rate variability parameters that indicated a parasympathetic dominance and improved HRV. And this study was found to be significant. A similar effect on another randomized control trial by Gatti, which investigated bumble humming breathing, bee humming breath, or what we call as Brahmari. They investigated this both on blood pressure and heart rate variability in patients with hypertension, and this had a positive effect on HRV, heart rate variability, indicating a improved autonomic function. So now we could see here in terms of heart rate variability, pranayamas like cooling pranayamas like Shitali, Shitakari, if it is externally induced, it can have a very significant impact on HRV. Similarly, in a Brahmahari also has a impact on both HRV, the heart rate variability, and the blood pressure. Now first we looked at the study which talked about the heart rate variability, and the third study talked about changes in blood pressure. And this is all the studies under this theme was concentrated in this particular category. Here it looked at Bastrika pranayam, the pranayam on the both blood pressure and heart rate variability. Now, if you look at this pranayama, how it has decreased the systolic blood pressure and diastolic blood pressure, along with a slight reduction in HR. This study by Pramanik, it brings out two aspects. One is it impacts the blood pressure, both the systolic as well as the diastolic blood pressure. In addition to that, it also reported that the heart rate also decreased. In terms of Jane and Schremal, they found that both physiological and psychological variables among the experimental, so they had two group, experimental group and here a non-experimental group. Now, among the experimental group, it was found that 6.14% systolic blood pressure was decreased, and 8.38% diastolic blood pressure was decreased. And this also, the intervention is a tele yoga intervention. That means through a TV medium. This was administered and included a 6-minute Bastrika pranayam and Nadi Shodhana pranayam. So 6 minutes of Bastrika and 6 minutes of Nadi Shodhana. This has resulted in a decrease in both these systolic and diastolic blood pressure. Now, another study by Tellis, they carried out a clinical research on alternate nostril yoga breathing, or what we call Anulom Vilom or Nadi Shodhana pranayam. And it also decreased the systolic and the diastolic blood pressure, and it was statistically validated at a 0.5% level. Tankalakshmi. Now, these were pranayamas like Bastrika and Nadi Shodhana. However, this study talked about Shitali Pranayam. Now, in a Shitali Pranayam, which, as we know, is a cooling pranayam, and it has reduced the blood pressure variables at a significance of 0.05 level. And another study by Rohini also investigated Shitali Pranayama, and it also found out that heart rate and the blood pressure parameters in healthy volunteers, it was found to decrease. Now, from these studies, we see a pattern. One, the Bhastika Pranayama, then Nadi Shodhana Pranayam, Shitali, have and impacted the blood pressure and heart rate reduction, and these were found to be statistically significant. In terms of changes in pulse pressure and mean arterial pressure, what we call MAP, Rohini et al.'s study, which is a randomized control trial, they found that Shitali Pranayama had a reduction of mean arterial pressure, that is heart rate, and blood pressure parameters. However, this was done in unhealthy volunteers. And 5 minute and 5 cycles of Shitali Pranayama have significant decrease in pulse pressure and the mean arterial pressure. Now, this indicates one important facet, the impact of Shitali Pranayama. And second is the frequency aspect. So, minimum, it is found that 5 minute and 5 cycles of Shitali Pranayama can have a significant decrease in the mean arterial pressure and also the pulse pressure. And another study impacted on the changes of ventricular performance. And pranayama has been notable to have found a decrease in ventricular performance. Udupa et al., in the clinical trial to investigate the effect, has found that the peripheral capillary oxygen saturation uh, it has been impacted in a positive manner. Jane's study also reported a significant changes in the physiological variables, including the oxygen saturation level by 2.07%. And this good part is both were through an integrated tele yoga intervention. So if you look at it here, what impacted is Bastrika and Nadi Shodhana. In respiratory rate, how does pranayama impacted on the respiratory rate? If you look at the Jain and Shrimal study, which integrated the tele yoga intervention, again, if you look at it, Bastrika and Nadi Shodhana has, and that too here, the duration also was found that 6 minutes has significant changes in both physiological and psychological variables. And this includes changes in respiratory rate by 10.04% compared to the control group. And both this has impacted both this pranayama, if you look at it, Bastrika and Nadi Shodhana, has impacted the respiratory rate. And another study was quite interesting, wherein looked at the surface body temperature. And Tallis examined the body temperature of practitioners. And in this study, they looked at Surya Bandhana and wherein and with the locks, the physiological locks and breath retention, like you do a Surya Bandhana and lock the chin and the perineal. And Surya Bandhana was done here without the physiological locks or breath retention. And then there was a control session. That means there was a Surya Vedana with locks, then without locks, and then there was a control group where just sitting. And it was found that the surface body temperature increased significantly during Surya Bandhana pranayam. Compared to this and the control group, there was a significant uh, difference. And with the physiological lock, that is this and this, there was a statistical difference of around p is less than zero point 0.1, around 10% significant level. As well as with this and this also, there was a significant decrease. So it indicates one thing, the Surya Vedana, whether you do it without lock or with lock, it is going to have an impact. Then comes the effect of pranayam on these psychological variables. So till now, we looked at all physiological variables like heart rate variability, blood pressure, SBP, the systolic and the diastolic, and then we looked at various other physiological characteristics. Now, this second part is the impact of pranayama on these psychological variables. Now, why is it important? How it can impact the cognitive function, the anxiety level, and the overall mental well being of the individuals. Now, in this study, which is by Bharadwaj, they investigated the efficacy of 12-week meditation and pranayam aided by an M Health, mobile health, in reducing the burnout and improving the quality of life. And this was done on healthcare service providers, like maybe nurses, doctors, and others. And they reported significant improvement in measures at a statistical level of P at 1% significant level. And they used the inventory of Nash Lash burnout inventory, which is basically a scale to measure the burnout, to assess emotional exhaustion, depersonalization, and personal accomplishment. And the professional quality of life scale also was used to evaluate the compassion, satisfaction, burnout, and secondary trauma. So, what does this indicate? That pranayama And meditation had an significant impact on psychological variables like emotional exhaustion, depersonalization, and personal accomplishment. Also, it has impacted the quality, the professional quality of life scale, and in that, compassion, satisfaction, the job satisfaction, burnout, and the trauma associated with it also has been found to be reduced by using pranayama. And there was another study by Chandala who explored the effect of short term practice on pranayamic breathing exercises. And they basically looked at the cognition, anxiety, general well being, and the heart rate variability. And it is reported that it has reduced the anxiety, improved the general well being, and the cognition level. And also, it has improved the parasympathetic activity, promoting general relaxation. Jain's study also looked at Nadi Shodhana, Bastrika Pranayam, and it also significantly impacted psychological variables like stress, peritraumatic distress using the peritraumatic distress index, and state mindfulness attention awareness scale. And if you look at these, that mindfulness has increased by 72% of the experimental group compared to the control group. Sharma study also conducted which was a randomized control study, which which looked at yogic yoga breathing on both attention and anxiety. And this involved six 18-minute sessions of alternate nostril bellows and bumblebee. So alternate nostrils would be Nadi Shodhana, bellows are like Bastrika, and the bumblebee is the Brahmahari. Now, these three have impacted and high frequency yoga breathing in a very fast frequency. This has result as well as breath awareness and quiet seated rest. The findings reveal that the breathing techniques have improved the attention span and also reduced the state anxiety. Now, this study brings in that how attention span has been improved by including 6 18-minute sessions. So, we earlier here there is frequency, time duration of session, and how these three techniques have impacted the awareness and promoted sustained attention. Taneja's study also, which consisted of basically a combination of asana and 12 asanas they used, and Surya Nadi Pranayama. That means the right nostril, the breathing is taken only through the right nostrils. And this also have significantly reduced the state anxiety. Now, this study is quite interesting to look at because here they have used Surya Nadi in addition to the 12 asanas which was considered in the study. Bhavanani is study, and it was also a clinical trial, and it tried to investigate Mukha a yogic bellow type breathing on the reaction time. They found that 9 times of Mukha significantly decreased the visual reaction time and auditory reaction time. These results indicate the sensory motor performance and enhanced processing of information. Mahesh Kumar's study also is an interesting one, which looked at the effect of 6 months of pranayama training on stress, specifically stress-induced salivary cortisol response. And this study was done among the adolescents. So now this is a longitudinal study which was being done, and 6 months they had observed how the impact of pranayama has been impacted on the salivary cortisol, which is a stress induced hormone. And they found specifically Brahmahari, which is a bumblebee breath, and 45 minutes, 3 times a week, over 6 months, led to a significant reduction in salivary cortisol level, indicating this impact is not just cross sectional, but also the horizontal, longitudinal aspect, also in terms of how pranayama has impacted the stress level, wherein the salivary cortisol levels were measured. The Telesis study also conducted a clinical trial, and what it did, it investigated the reaction time following the yoga bellow breath and breath awareness. Now, here in it's yoga bellow breath is like a bastrika, and they try to be aware. Like sometimes we do a 5 rounds of bastrika and then try to be aware of the breath, and this was found that this reduced the anticipatory responses, specifically in terms of reaction time, leading to a significant impact on the overall well-being of individuals. Overall, if you see, both these studies, both physical as well as psychological variables, has been impacted by the use and practice of pranayama. Now, let us look at some studies which has specifically had an impact on the type of disease like obesity. Now, in a clinical trial by Kasturi and Dio, and who investigated the effectiveness of forced right nostril breathing and also some specific yoga asana on obese female college students. And it is found that the right nostril breathing alone with certain type of yogic posture had an impact on the reduction in obesity. In terms of asthma, pranayama was shown to have a significant benefits for individuals with asthma. Now, this is a randomized clinical control trial which was conducted by Yadav and specifically Brahmahari and Om chanting. This has impacted asthma control and also quality of life, and airway inflammation in children with asthma was found to have decreased. Now, the study found that these practices improved the asthma symptom control. It has improved the quality of life and reduced the inflammation in participants. Another technique in terms of pranayama has impacted the irritable bowel syndrome. And if you look at this, is one of the uh, illness which has been since it's called a syndrome, impacting various individuals. In one study, they say 1 in 3 individuals this disease is being seen, or the syndrome is being seen. So an RCT by Taneja, they investigated that yogic versus conventional treatment. That means they gave a yoga treatment, they gave a conventional treatment of diarrhea predominant. Now, there is two types of irritable bowel syndromes. The first one is a diarrhea predominant IBS, and also constipation predominant IBS. Now, in diarrhea predominant IBS, they found that 12 set of asanas along with Surya Nadi pranayam, which is the right nostril breathing, which has significantly reduced the bowel symptoms. And also, conventional intergroup invention group showed increased gastric activity. Now, if you look at this yoga has decreased the IBS symptoms, and gastric activity was not impacted. However, here in this study, the conventional intervention along with gastric activity was found to be decreased. Now, this brings us that how does pranayama impact the quality of life. Now, we looked at the physiological variable, psychological variables, and now we are going to look at the quality of life as a whole in pranayama. Now, studies indicate that pranayama techniques can elevate symptoms associated with various health conditions. Now, take for instance the study by Dhruva et al., who assessed the effect of yoga breathing on cancer chemotherapy associated symptoms and quality of life. Now, what did they observed specifically? Technique like breath observation, Ujjayi, Kapalbhati, and Nadi Shodhana. This pranayams was specifically looked at from a cancer chemotherapy associated symptoms perspective to understand the quality of life. And it found that sleep disturbances were reduced, and this reduction in sleep disturbances was statistically significant. Anxiety reduced, and it is statistically significant. Same is the case with the mental level quality of life. This also improved and approached to statistical significance, indicating how pranayama can be used as an alternative or a complementary tool along with chemotherapy and so on. Jaya Bharati and Judy, they conducted a community-based interventional study, and they explored the health approaches which are aimed at enhancing the quality of life, and this was specifically targeted at menopausal women who are undergoing menopause. And what they found that using yoga therapy, specifically nadi shodhana and shitali pranayam, when it is practiced 8 to 10 times for 5 to 10 minutes, it led to extremely high statistically significant improvement in physical, psychological, social, and environmental domains of quality of life. Now, this study is quite significant because it looks at women, menopausal women, and it also looked at specifically two pranayams. One is Nadi Shodhana, and the second one is Shitali. And what did it impact? It was found to impact the physiological various, the psychological variables. It also impacted the physical variables, social variables. It improved the way you conduct yourselves in the social manner, and environmental variables too, indicating how your consciousness towards the environment also improves by using yoga. And specifically, the participants in this group was post menopause, menopausal women. Now, these evidences suggest that incorporating pranayama into a daily routine can enhance various dimensions of quality of life. And if you look at it, even as little as 8 to 10 times they practiced these both pranayama, that is Nadi Shodhana and Shitali, for 5 to 10 minutes, and this has led to this improvement. This makes us ponder the understand the importance of pranayama in the well-being of a physical, psychological, social, and environmental well-being of an individuals. So this video was basically devoted towards understanding the impact of pranayama on these variables. So with this, we end this live stream. Thank you for your patience here.